welcome to those who have joined us for this webinar hosted by the Centre for Mental Health as part of their Festival of Ideas series. Today, we're going to be discussing the climate crisis and its impact on mental health. I'm Pete Coventry. I'm going to be chairing today's event. I'm a mental health researcher and a senior lecturer in health services research at the Department of Health Sciences at the University of York. I also work with Professor Piran White, who's joining us today as one of the speakers, as the co-lead for the Environment and Health Research team at the York Environmental and Sustainability Institute, known as YESI. Before we do get started, I just wanted to let everyone know how this webinar will work today. There are a few housekeeping rules that we ask everyone to agree to. As you can see, we are recording today's webinar, so we can share this afterwards. As you can see, also the chat is open, and do introduce yourself if you've got a moment. We will be muting the chat during the presentations to minimise disruption, but then we'll reopen the chat at the end for the Q&A session. And just to bear in mind, if we don't get to all the questions, we will be following up questions in a future blog posted by the Centre. And for those of you who want to, you can access the closed captions on this webinar. If you click on the CC icon on your Zoom toolbar, you will have closed captions. Good, I can see many of you are already starting to say hi in the chat, so you can do that for the next minute or so. Whilst I just sort of set the scene before we open this up to our speakers, we've got a series of interesting talks on climate change and mental health, and we hope that these talks will prompt lively discussion. And when we were planning this webinar, I guess we weren't expecting to be discussing this topic in the shadow of what has been one of the most extreme heat waves across Europe. And extreme weather events across the globe have once again forced climate change to the top of the news agenda. Much of that discussion is about the impact of climate change on health in general. For example, increases in injury and death from extreme weather, heat-related illnesses, the increased risk from vector-borne diseases, for example, and the mental health impacts can be squeezed out of that conversation. So even, for example, a high-profile collaboration like the Lancet Countdown on Health and Climate Change only tangentially mentions mental health in their Lancet publications. And one of the aims of today's webinar is to generate interest and support for further research about the relationship between climate change and mental health. And as with physical health, climate change can affect mental health in different ways. It can affect health directly. For example, days of extreme heat have been shown in the US to be associated with increased incidence of emergency department visits for mental health problems. And indeed, a recent systematic review published in Lancet Planetary Health has shown across the world extreme heat events are associated with increased risk of suicide and suicidal behaviours. We can also think of the complex pathways by which human-driven climate change can affect mental health. Atmospheric pollutants directly are responsible for increased risk of mental health. And in the UK, transport is the largest contributor of CO2 emissions, and domestic car use is the worst offender, contributing for over 50% of greenhouse gas emissions. But beyond contributing to greenhouse gas emissions, the use of domestic vehicles produces high levels of NO2 and NOx, which has been shown by researchers at UCL to be associated with the increased risk of adolescent psychotic experiences. We also know that climate change can impact mental health via more indirect pathways through degradation of ecosystems that support life, for example, damaging food systems following droughts and floods. And then there's a spillover from collapsing ecosystems that can drive social determinants of mental health, for example, rising food prices and food insecurity, job losses following damage to infrastructure, conflict, forced migration and displacement from homes following flooding, for example, many of which can lead to traumatic stress responses. And we know that climate change is more than likely to disproportionately affect the very old and the very young and those with pre-existing mental health problems. And so in that sense, it represents a challenge in terms of social and health inequalities. But more optimistically, we have creative solutions in the offing. We know, for example, that the availability of green space in city centres can mitigate the effects of climate change on mental health. Green spaces can cool urban heat islands up to 3.5 degrees C, and certain types of street trees can offer protection from the effects of heat. And also, research in the UK using biobank data has shown that higher levels of residential green space is associated with reduced risk of developing depression and higher levels of well-being. And there are also perhaps service or system level innovations that might help promote the use of low carbon treatment choices for mental health. At York, we've carried out research looking at the benefits of green social prescribing and shown that the use of nature-based interventions such as food growing, gardening, green exercise, conservation activities can support good mental health. So there's the prospect of innovations that can lead to more sustainable approaches to existing mental health treatments and perhaps lead to more sustainable approaches that can promote both environment and health co-benefits. So on that slightly more optimistic and upbeat note, I'm very pleased to welcome our first speaker, Agnes Agyepong. Agnes is the founder and CEO of Global Black Maternal Health. Agnes.
Hi everyone, thank you for having me, and Pete, thank you for that introduction. It's quite interesting because at the moment I'm currently in Ghana, where I attended a conference last week by the Second Lady of Ghana called Amplifying the Voices of Women and Children in Climate Action. And I thought, you know, it's really interesting before I go into my presentation, just to kind of spotlight the fact that we're already looking in Ghana, we're already looking at, you know, inclusion and how we can make sure that people whose voices are marginalized, as well as children and women, play a central role. And that's going to be the theme of what I'm talking about, based on the work that I do in the UK. So my name's Agnes Agyepong. I'm the founder and CEO of Global Black Maternal Health. And the topic of my talk today is climate change as a racial justice and social justice emergency, and looking at this through a mental health lens. Next slide. So about me, so I'm a social impact entrepreneur and maternal health advocate. So that's how I found myself doing work around the environment and climate change. If somebody had told me about 10 years ago I would be focused on the environment, I wouldn't have believed them. But as I started delving deeper into maternal health disparities, where Black women in the UK are nearly 4 times more likely to die, we're twice as likely to experience stillbirth, as well as preterm birth, infertility, and a host of other reproductive challenges, I started to see the correlation between the environment, particularly the air that we breathe, and the health outcomes that we're receiving. So that's how I kind of fell into this work. On the back of this, I launched a first of its kind study called Black Child Clean Air, which looked at the attitudes, the behaviours and the awareness of Black communities in London who are 3 times more likely to breathe illegal levels of air around air pollution. And what we know is there's climate change and air pollution, but there's a family here. It's which one comes before the egg or the chicken. And actually by solving issues of air pollution and toxic air, by default, you're going to solve issues around climate change. And what I also started to understand, or what I also started to delve with the work that we're doing, is the more that we delved into toxic air and climate change and the impact of air pollution on marginalized communities, naturally, as well as the health impacts, we started to uncover the mental health challenges around this. Next slide. So how does climate change impact mental health in the work that I'm doing? So I mentioned the Black Child Clean Air report, and I recommend for those that haven't viewed our work, just to check out our website. I don't have enough time now to go deeper in. But really what we're saying is Black maternal health, where we're seeing this increase in maternal mortality and morbidity, air pollution and climate change, it intersects. What we're seeing is higher risks, as I said, of pregnancy complications and stillbirths, preterm births, miscarriages, and child ill health. Now, when we're looking at even things like postnatal depression, which exist within mental health, can you imagine how just by finding out the fact that the air that you're breathing is also playing a role, and the trauma of actually, well, maybe I can't move, or I can't just solve that challenge. What we know within London in particular, the area that we did this work, is that those that are most likely to breathe illegal levels of air are least likely to actually be contributing towards toxic air. But yet, what can you actually do about that? So that does play a toll on your mental health, because you now know about the kind of toxic air. You now know how climate change, and we've seen that with the rising heat, not so much this summer, but last summer it was very hot. But there's not much that you can actually do for that. So there's challenges there. Next slide. So climate change and mental health. So when we're looking at the topics that I'm talking about here, it not only exacerbates health disparities and environmental justice, but it has a psychological toll. And that's the kind of key theme that you'll hear me mentioning. The mental health implication for individuals and communities. We know about this from a kind of a chemical imbalance point of view as well, but just the fact that there's nothing you can do, or you feel that there's nothing that you can do. But I also want to hone in on the fact that within the UK in particular, it's a bit different in Ghana, as you can imagine, but in the UK, the environmental sector is the least diverse sector next to farming in the UK. So even the voices of Black and brown communities coming through, talking about actually, what does climate change look like from my lens? What does environmental injustice look like from my lens? That's not reaching to the top of the ladder, typically because we're not there in the numbers that we should be. But also the multifaceted effects: stress, anxiety, grief, intergenerational impact. So when we're talking about children, when we're talking about stillbirth, when we talk about miscarriage, there's an intergenerational impact there that's happening, not just on the women, but the children, on the family, on the community. Advocacy fatigue. I can't express how many people I speak to on a daily basis who feel so tired in terms of, just kind of fighting the injustices that are happening. Who is listening? How can we ensure that our voices are heard at the highest level of policy, but not just on a performative level, on a level where actually it's making a difference? The lack of agency, coping challenges, and one that I experience all the time, burnout, just the general burnout of having to do the most and oftentimes not having the adequate support. Next slide. So when we're looking at specific impacts on Black maternal health, what we're finding now is the more that we are raising the awareness of air pollution's impact on maternal and child health, we're raising that impact, or we're creating a raised awareness within the community, which is fantastic for people to be aware. But then what? What's the next stage? But what we're finding is community trauma, that perpetuation of injustice and collective distress. People feeling like, what? For some people, they wish they didn't even now know that there's another layer on the injustices that they're already facing. The grief and loss, coping with increased rates of adverse outcomes. For many of you, you may have already have heard about the shocking stats around Black maternal health, but just coping with that increased awareness and knowing that actually the environment plays a role on that, that's also a compounding trauma. Again, I spoke about advocacy fatigue, burnout from addressing these systemic inequalities, and then that intergenerational impact that I mentioned earlier. Next slide. So there's challenges in addressing mental health. There's the inequity, sorry, we go back. Hi there, would you be able to just go back one slide? There we go. So we see the challenges in addressing mental health. We already know within the mental health sector, there are already challenges, oftentimes for Black communities in particular. So you can go forward. What we already know within the Black community in particular is a lot of the time as a community, we're only entering mental health services through the criminal justice system. So there's already those challenges there when we're looking at mental health in general. The lack of resources, so there's limited access to mental health services, oftentimes in marginalized communities, full stop. And then when we're looking at cultural factors, there's stigma, lack of culturally competent support. There's so many women that I speak to that talk about their faith and how when they've had to access mental health services, they've been very careful not to talk about their faith for fear that it will, they will look more and quote unquote crazier than what they're perceived as being. So that lack of cultural awareness already at play. But there are strategies for mitigation. There are things that we can be doing right now. So education and awareness, raise awareness about climate change's mental health impacts and provide information about coping mechanisms and support resources. So it's all, fair and well saying, this is climate change or this is air pollution and this is what it's going to do for you. But what are the mechanisms and what are the resources that are also going to go alongside that to help people cope with all this information and just cope in general. Community resilience, so foster community support networks to address that collective trauma, because there is already a trauma there. So it's ensuring that communities who are already doing the work on the ground have those resources there to support people who may now have added trauma because of the added information. And empower community leaders as mental health advocates. There's so many community leaders who are already doing work on the ground. So how can we collectively ensure that those community leaders have the right support to be able to iterate these messages and these support mechanisms on the ground? Policy advocacy. We need to advocate for equitable policies to reduce air pollution and address systemic inequalities impacting Black maternal health. Because what we're seeing here is actually Black maternal health, that's the wound, but we need to go further or go back and actually look at how the policies in place around climate justice, around clean air, actually are impacting marginalized communities that are resulting in these outputs. Culturally competent care, I can't stress this enough, and I feel like that's a topic amongst itself. We need to develop culturally sensitive mental health services. We need to incorporate cultural traditions and perspectives in support strategies and collaboration and partnerships. One body can't do this all by themselves. Yes, there are amazing community leaders who are already on the ground, but collaboration is key. Next slide. Hello, next slide, please.
Hello, I think there might be a delay. I've changed over the next slide, but I think there's a little bit of a delay for you. Are you seeing it now, the summary?
No problem. Yeah, that's fine. That's fine.
Fantastic. All right, thank you.
So just to no problem. Just to summarize, there's an urgent need for action. Climate change's impact on mental health exacerbates health disparities. And we already know here that if you're already having a health challenge, your mental health will also be impacted as well. There needs to be holistic approaches. So addressing mental health alongside maternal health and air pollution interventions, and then empowerment and equity, ensuring mental health support reaches marginalized communities for a more just and sustainable future. Next slide. Thank you, and you can reach me on any of these platforms. Thank you so much.
Thank you, Agnes, for that very thought-provoking talk, which I'm sure has stirred lots of questions about, yes, how do we address that collective trauma amongst Black and brown communities in the context of climate change? So thank you for starting this webinar with that. I'm going to move swiftly to our next talk from Elliot Busari. So Elliot describes himself as a mental health enthusiast, activist, and aspiring clinician. So Elliot, we'll just get your slides up and then hopefully you can start your talk. Can you see those slides?
Yeah, brilliant. Thank you so
Brilliant.
much.
Okay, yeah, over to you, Elliot.
Thank you. Brilliant, and thank you, Agnes, as well for that. Really, really excited to speak to you. So yeah, my name is Elliot. Today I'm going to be talking about creativity in the climate, and change making and creating change. So as Pete mentioned, yeah, one of the things I enjoy doing, and one of the things I'm really passionate about, is mental health, activism, advocacy, and all of that sort of stuff. So I'm just going to talk about how there might be a bit of a link between, well, not might, there is a link between the climate and yeah, that sort of advocacy. Next slide, please. Brilliant. So before I start, I just wanted to give a quick challenge. So I wanted to ask a question. If there was one thing you could change in the world right now, what would it be? Like what would the first thing that pops to your mind, what would that be? It could be as big as something like changing the national voting age to 16, or something more personal like making Leo the official shortened form of Elliot. That's really personal to me because yeah, with my Lutonian accent, sometimes when I say Elliot, people hear Leo. I don't know why. But anyway, I think it would be great to do that. So yeah, and that's actually my Starbucks name. So it's because it's pretty simple. But yeah, that's just a thought. Next slide, please. Yeah, if you could just hold on to that idea, that big change idea, if you could change one thing in the world, what would that be? We're going to come back to that at the end of the presentation. But yeah, next slide, please. Brilliant. So as I just introduced myself, one of the things I enjoy doing is making change. And I'm actually part of a project called Change Makers. And for me, I thought it would be really great to start off with an introduction about what a change maker actually is. So for me, a change maker is someone who communicates an issue and then communicates solutions to an issue. So in this particular circumstance, it might be mental health disparities. And the key thing is to do that in a way that's convincing, memorable, and noteworthy. Next slide, please. Brilliant. So what I do is I do creative change making. So obviously all change making has some sort of creativity to it. But one thing I'm really passionate about is using the arts to communicate ideas and inspire more creativity, essentially. So, you know, what a creative change maker is to me is someone who captures complex ideas and reimagines them in a way that allows them to be felt as much as understood. So, for example, in this sort of line of work, there's so many complex ideas to do with, you know, whether it's how environmental injustice impacts the mental health of marginalized communities, communicating that in a way that's not just understood intellectually, but actually felt is really important, because we're not just speaking to minds, we're speaking to hearts. And that's a big part of how we see change. Next slide, please. Brilliant. So I just wanted to talk about the role of a really inspiring creative change maker for me. That's Maya Angelou. She was an influential writer, educator, and poet who used her creativity to advocate for and draw attention to the civil rights movement. And she's famously known for the poem, I Know Why the Caged Bird Sings, and has an autobiography of the same name. And this all will make sense as we go on. Next slide, please. So creativity and the climate. How does the climate affect what I do as a creative change maker? So natural environments and environments enhanced with natural elements have been shown to improve creative performance when compared to urban environments. So it's a really important thing to sort of protect our local communities in the way that they integrate sort of nature with obviously the new buildings or the whatever projects are going on in that community. And nature exposure has been shown to have a positive link with creativity. But obviously environmental injustice means that marginalized groups potentially have their creative expression stifled. And obviously, as I've talked about, since creativity can be such an integral part of change making. So I gave the example of Maya Angelou, who was really influential in the civil rights movement. Yeah, since they're so important in that, yeah, not sort of supporting that development and that sort of protecting the climate in local communities can actually stifle and silence voices, essentially. So nature can be an important and really big inspiration for change. Next slide, please. So some uncomfortable stats here for you. Brown and Black people are twice as likely to live in a neighborhood with minimal access to green space. Almost 40% of people from minoritized backgrounds live in the most green space deprived areas compared to just 14% of white people. And why these stats are really significant is because, as I've talked about, creativity and access to green spaces are really important. They're really linked together. And so it says here also that children from the most deprived areas are 20% less likely to spend time outside than those in affluent areas. So this goes back to another point, that nature is a huge inspiration for change. And unfortunately, if people don't actually have that time to spend outside and enjoy and engage with nature, they might not really feel the impact as much as it may be impacting them. Sometimes it's hard to disseminate statistics, and it's hard to sort of prove a point to people, like I've talked about, because it's not just minds we're speaking to, it's hearts we're speaking to. So it says here also that the average amount of public green space for people in the most deprived green space neighborhoods is less than 9 meters squared, or the average side of a garden shed. So that's, again, just to highlight the uncomfortable situation, which I'm sure a lot of us will know we're in. Next slide, please. So linking this all together, this is an example from my work of what I've sort of done and why all of this is so important for me. So I wrote a poem called Fields of Freedom, and it was for a project focused on creating an urban community garden. And that was in collaboration with Wild City Studios and Center for Mental Health. And the idea is just, obviously we know the benefits of nature for mental health, and also, you know, with the statistics I talked about earlier, how important they are, especially in marginalized communities. So this project focused on creating a community garden, and it was displayed at the Royal, it was the Chelsea Flower Garden Show, and then it's currently being moved to an area in Tottenham. And basically that poem was inspired by my own experience engaging with nature and how beneficial it's been for my mental health, you know, because I've been fortunate enough to have to be in a community now that they've done some work in my local community, so I can actually go out and engage with nature in a great and enjoyable way. And it was inspired by my own experience, and also by Maya Angelou's poem, I Know Why the Caged Bird Sings. And I guess that really just highlights again why nature is so important, and protecting our communities in providing that access is so important. And you can see the YouTube video there. So if you are interested, go and check it out. Cheeky plug. It's on the Center for Mental Health's YouTube page. Next slide, please. So climate anxiety and changemaker pessimism. So there are change makers focused on different issues and communicating different solutions all over the world. And whether they are directly climate crisis related or not, investing in a greener future encourages hope. It reminds us that change makers, that there is a future worth fighting for, and it brings that sense of community. It brings a community of learning, support, and development. A lot of rhetoric sometimes is passed around climate activism, that it's actually it's a negative thing for climate anxiety. So, you know, if you expose people to the actual issues going on, and if you engage them in sort of activism, it's going to make them more. But actually, a lot of research has shown that it is actually a positive thing for climate anxiety and in general, because it does create that sense of community, of learning, of support and development. And next slide, please. So just to round it off, I want you to think back on the first question I asked you about that big change idea you had. So imagine you are asked to deliver a speech or performance for a big event to convince key decision makers to pass through your big change idea. And then you decide to take a walk outside to think and prepare. What would your walk look like in an ideal world? If you walked outside, what would it look like? What would your street look different? Would your local park look different? What's different about it? And I think thinking like that, does encourage us to continue to invest in protecting our communities and ensuring that we do have that space to go out and be inspired by nature. And yeah, thank you so much for having me.
Great, thanks, Elliot, or should I say Leo. Brilliant talk, really, really, again, thought-provoking and different sort of angles for us to think about. I will move again swiftly on so that we do have time for questions to our final speaker, who is Professor Piran White. Piran is Professor of Environmental Management in the Department of Environment and Geography at the University of York. Piran, we'll get your slides up.
Thank you, Pete.
Yeah, brilliant. Okay, over to you, Piran.
Thank you, Agnes and Elliot, for some great talks. So I'm going to talk about the climate crisis and mental health, and specifically about impacts and opportunities through nature. So as we've heard, climate change is leading to an increased frequency of severe and often unseasonal weather events like storms, heat waves, wildfires, droughts, floods, and so on. And these can all have a serious impact on health. As Pete mentioned, heat can exacerbate air pollution, contributing to mental health problems, but also cardiovascular disease. We know that climate change and weather also impacts biodiversity ecosystems. So warmer and wetter conditions can increase the range and abundance of insects that carry disease. And they can also cause declines in fish and wildlife due to climate change that threaten people's livelihoods and therefore affect mental health and well-being. One of the other things that we need to remember, as others have mentioned, is that physical and mental health are really closely aligned. So while the initial impact of climate change may be on someone's physical health, in turn, that may have impacts on their mental health as well. So in this talk, I'm going to draw on my research in the UK, as well as in different parts of the world, to highlight how climate change can have an impact on mental health, but also think about how, by working with the natural environment, we can maybe try to reduce some of these impacts. So I can have the next slide, please. So most of my research on climate change and mental health has focused on the impacts of flooding. And in the city of York, shown here, where I'm based, York's often affected by flooding. It had very severe floods in 2000 and again in 2015, where the rivers peaked about 5 meters above their normal level, and 600 homes and businesses were flooded, and about 250 people had to be evacuated from their homes. Being exposed to floods can sometimes lead to injury and loss of life, although this is relatively rare in the UK. But even when direct impacts are less severe, there can be still enduring impacts to people's mental health. And we know from a lot of research that the risk of long-term mental health problems is 4 to 9 times higher for people who've experienced flooding compared to people who've never experienced it. And even some years after a flood event, people affected by flooding can experience increased levels of stress, sleep problems, panic attacks, difficulty concentrating, mood swings, and increased use of alcohol and prescription drugs. And evacuation and the need to live in temporary housing can also increase levels of anxiety, depression, and PTSD. Research has also shown that exposure to flooding can impact people's social relationships. So in the UK studies, people who've been exposed to flooding find their relationships become more stressful. They can increase levels of arguments and in some cases divorce. But some people can also experience an increased sense of belonging through belonging in their community, through supporting others and being supported by others as they seek to recover from flood events and exposure. Can I have the next slide, please? So in some of my research in the Caribbean coast of Colombia in South America, I've been investigating how climate change and other changes can affect the well-being and livelihoods of people who live on and near coastal lagoons, as shown in this picture. Here, increasing severity of floods and droughts, combined with rising sea levels, population expansion, urbanization, road building, and so on, are all putting immense pressures on the people living there and their livelihoods, which are principally to do with fishing from the lagoons, as shown here. Next slide, please. These communities are strongly dependent on the natural environment for their economic well-being. They're actually used to a lifestyle that involves adapting to floods and droughts. When floodwaters rise, they move to a neighbouring dry house or they sleep in their boats. And for people that live in stilt villages, like the one shown in this picture on the lagoon, they simply build an extra floor onto their house to stay above the floodwaters. But with climate change, floods and droughts are becoming less predictable and also more extreme and more prolonged, and these well-established responses are no longer sufficient. Excessively rainy periods result in high levels of insect-borne diseases, and people from the community say that the stormy conditions mean it's not safe for them to go out on the lagoon and do the fishing. And they talk of the trauma of everything they've built, including their homes and fields being destroyed by the floods, which then take months to rebuild. They say that family and social networks are really important, they're critical for helping them to get through these tough times and to rebuild. But for many in these communities, the effects of climate change have already been too much, and many people are starting to move away, whether seasonally or permanently, to cities in search of work. Can I have the next slide, please? And this research in Colombia has highlighted how the effects of climate change on mental health is linked with many other factors, and particularly in this case with biodiversity and the natural environment. Recently, I've been involved in a project looking at the impacts of climate change and health and well-being in the Bay of Bengal, which is shown in this picture. And we've been working in parts of coastal parts of India and Bangladesh. In some parts of coastal Bangladesh, there have been up to 200 extreme weather events linked to climate change over the last 20 years. And in the Chakaria region, where our project has been based, the communities talk about how the mangrove forest, which fringes the coast, that used to protect them from storm surges, from cyclones and so on, has been destroyed, leaving them directly exposed to these extreme weather events. The high temperatures lead to increased heat stroke and heart attacks. Flooding has increased rates of diarrhea, dengue fever, skin diseases and malaria. And community workers speak of how we've also experienced increases in rates of miscarriage and deaths due to complications of pregnancy that can't be treated properly because the extreme weather has destroyed infrastructure and health services. Next slide, please. So in places such as Colombia, India and Bangladesh, much more needs to be done in terms of sensitizing multiple local and national governments to recognize the significance of the health impacts of climate change and prioritize them and take action. Infrastructure and health services play a vital role to support people's mental health in the face of climate-related extreme weather events. But we're also recognizing there's opportunities to reduce their impact through making better use of the environment as a means to provide some protection for the worst impacts of these events and to mitigate some of the other health impacts from climate change. And this approach, making use of the environment, is sometimes called nature-based solutions. And this brings me back full circle to the work I'm currently involved with in the UK. Next slide, please. So in the UK, the government's committed to an ambitious programme of tree planting and woodland expansion. It's committed to increase woodland cover from 11% currently in England to 17% in England by 2050. And the primary aim of this is to tackle climate change by absorbing carbon and helping us to meet our 2050 net zero target. But trees and woodlands have multiple other benefits as well. They enhance biodiversity, which tackles the biodiversity crisis and the decline of loss of many of our species. And they're also important for benefits they bring to health. So they filter pollutants, they provide cooling, important especially in urban areas, and they provide spaces in which we can walk, play, interact socially with others, benefiting our mental health and lowering our stress levels and improving our mood. Have the next slide, please. As another example of a nature-based solution to impacts of climate change, I'm involved in a couple of projects across Yorkshire looking at the benefits of what's called natural flood management. So natural flood management makes use of natural processes to hold up water in the landscape and reduce the risk of flooding downstream. It can include things like planting woodlands, as well as changing river channels and creating natural dams, just shown here, and as well as reducing flood risk and hence reducing mental health impacts of flooding. There's a potential for natural flood management to bring wider benefits to health and well-being, especially where it's done in areas where people can benefit from accessing the more natural environments that are frequently created. Can I have the next slide, please? So climate change is already having and will continue to have severe impacts on people's mental health throughout the world. In the UK, we're already seeing these effects, although we're probably fortunate compared to many other countries in the effects that we're already experiencing. Preventing and reducing the worst impacts of climate change requires a joined up effort across authorities, services and communities and between the local and the global. We're starting to realise the importance of connections between climate and change and wider environmental changes. And this can help to understand new approaches that can bring multiple benefits, not only to mental health, but also to the environment and our future climate. And it's likely that these types of approaches are going to have to play an important role if we're going to reduce the worst impacts of climate change and protect our mental health, and give us an opportunity to live better and live well in a warmer and definitely less predictable world in the future. So I'd just like to thank my contributors to the findings of research that I've summarised very briefly in this, and also to the funders for funding our various projects over the years. Thanks.
Thank you, Piran. Brilliant stuff, and certainly food for thought in terms of the international context as well as the UK context, and thinking about nature-based solutions, which I hope we might get a moment to touch on in the Q&A. So thank you to Agnes and Elliot too. We do now have 10-15 minutes for questions. The chat is open, but we also have a set of pre-submitted questions, which I'd like to start with first. Many of which touch on some of the themes that have already sort of been prompted by the talks today. And in no particular order, and do feel free to raise your hand, Piran, Elliot, or Agnes. I'll kick off with a question that was submitted by Claudia Turbe de Loff. I don't know if Claudia is with us today, but she's asked whether are there studies or recommendations about air quality and the impact to our mental health that we can consider and join forces to support. So I think that question is around how do we address things that in a sense offer environment and health co-benefits. So if we tackle air quality, that can potentially address also the impacts of climate change. I guess, Agnes, you might have a thought on how we can sort of, that twin approach might be able to sort of yield benefits.
Yeah, so my network is cutting on and off, but I did have that question already. Yeah. I think number one is just the fact that there's been so many numerous studies. I know I spoke through the lens of Black maternal health, but just in general, when we're talking about toxic air and the impact that just has on your mental health, full stop. And I know Elliot was speaking about just those green spaces and opening that up. One thing I would like to say is, you know, living in London, born and raised, I thought I was near green spaces, and then going to the Cotswolds, for example, I understood I'm not near green spaces. So also that lens of what we consider to be green spaces is very much dependent on where you've grown and where you were raised, if that makes sense. But I do think things like, which are controversial, like ULEZ and other different policies, I do think they are important, but where I do think the challenge is that where there isn't enough knowledge, and this is what our report found, on just even the impacts of air pollution. So I know Piran was speaking about, you know, climate change and how that causes air pollution, but when there's no impact on what that actually then does to the body, if you put in policies, it just feels quite punitive to a lot of communities. It feels like you're doing too. So I think there's a whole piece of work that needs to be done on how do we bring different communities to the foray for people to understand that actually it's not, policies are not being done to attack or to pull people down, but actually it's to help you to breathe cleaner air. So I just think there's so much that needs to be done on that area. If I've missed some of it, it's because it was cutting off. So I hope I've answered the question. Yeah.
Yeah, very useful thoughts, Agnes. Thank you for that. I don't know if Piran Elliot wants to add anything to that question, or we can move on to the next one.
Yeah, I can add a little bit.
Piran,
so yeah, I think there are, as Agnes referred to, there's an increasing number of studies that do highlight the impact of air pollution on mental health, especially around particulate matter, that it's becoming increasingly recognised how particulate matter affects our health, but also nitrogen oxide and nitrogen dioxide as well. So there's more and more studies out there. I think the real challenge is developing policies that address that without increasing social inequalities and environmental injustices. And that's a real challenge, as we've seen very recently in the debates about the ULEZ scheme in London. And the local authorities considering implementing these in various other cities in the UK and around the world, it's often with these environmental policies, it's the people who can least afford it who are worst affected by these impacts, but they're also worst affected by the policies. So I think the real challenge is developing policies that are actually more intelligent policies that can address these environmental problems, but at the same time don't increase social inequalities and environmental injustices. And I think that's where the real challenge is.
Thanks, Piran. And a really important point about, I guess, unintended consequences of policies that ostensibly are to address the impacts of climate change, but can actually compound the impact on more vulnerable communities. Which brings me to the question from Tony Lee, which is around how communities at risk might have been involved at initiatives that can build climate resilience. So he's asking whether there are any examples or case studies of at-risk communities. And I guess here we can talk about communities such as Black and Brown communities or other vulnerable communities who have been actively involved in sort of generating that sense of climate resilience. And I think, Elliot, I mean, you were hinting at this in your talk about how your approach can sort of enhance and build that community sense of ownership of solutions. I don't know whether you've got any thoughts on that question.
Yeah, I guess I'm sure there are loads of sort of case studies, but I guess I'd just go back to the example of the recent project I worked on, where they're creating a community garden in Tottenham. So yeah, I'll definitely point towards that one. But sorry, just to touch on the question, was it how, or was it?
Just if there are examples that you might know of, or sort of instances where you're aware of sort of communities being actively involved in generating that sense of community resilience.
I'd be happy to pass it on to Agnes if she has it.
Yeah, well, Agnes has got her hand up. I can see she's got a Zoom hand up.
Yeah, sorry, I don't want to be one of those ones that talks too much. But I think the fact that the environmental movement in the UK is the least diverse industry next to farming means that actually, unfortunately, we don't have too many people from Black and Brown communities doing or involved within this work. And I think that's the challenge before we can actually look at what the outputs are. I did a bit of research and I saw in Cornwall and, in certain other places, yes, there was work being done, but I can just talk from a London-centered perspective. A lot of people, when you talk about environment or you talk about climate change, it's something that's going to happen 50 years, 100, 200 years. And we saw with little Ashak with the mold and damp in his house, if you're at the present dealing with key issues like the cost of living crisis, like damp and mold, and that's currently affecting you right now, and the movement as it stands hasn't kind of intersected with your every single day, it just makes it feel that actually the climate change sector or the environmental justice movement isn't something that I should be engaged in. So I think in addition to actually looking at, okay, what's being done now, how can we involve different communities as it stands now so that people feel like they have a leading voice and can actually communicate, what does climate change look like for me right now? What does clean air look like for me right now? And then from there, giving the community or empowering communities to come up with solutions within their own community.
Yeah, no, thank you, Agnes, for that point. Definitely clear to me, I think, in my research, how participatory approaches are so fundamental to ensure that those with lived experience have a voice in creating those solutions. So, yeah, very good point. Piran, you've got your hand up too.
Yeah, I was just going to make a couple of additions. So certainly in the area of natural flood management, there are quite a few examples where communities are actively involved in programs to develop these initiatives locally. But often it's not necessarily the community on its own, but comes back to the point that Agnes was making about the support. And the community, if they have the right support, the community can often be much more effective. And it is often a combination of non-government organisations, charities, business, local authorities. It's that combination that needs to work effectively together. And often with the work that I've been involved with in Colombia, there's loads of local knowledge and traditions that can help in terms of countering some of these issues and finding quite innovative solutions. But the problem there is that on their own, the communities don't have the resources and capacity to do this. So if they're supported in the right way, they can do it, but often the support doesn't come in the right way. And often in those sorts of environments, it may be temporary support from aid agencies who might come in, support something for a year, get something off the ground, but then they'll walk away having achieved their objectives. And the community's then, left in limbo essentially, because they can't on their own carry on doing these things. And sometimes that can actually make problems worse. And the community develops basically a mistrust of people coming in with good intentions, but they've seen it time and time again, it doesn't have the longevity and the legacy that it needs. So I think there's lots of potential, but it needs to be developed in the right sort of way and with the right sort of support.
Thanks, Piran. I'm going to just try and rattle through a couple more. And the time we've got left, we've got a couple more pre-submitted questions. So one from Essian is essentially asking the panelist, what do you think will be the greatest impact on climate change mitigation and adaptation? Is it going to be regulation, so policy solutions and sort of governance, or technology? Can we innovate ourselves out of this crisis? What's people's perspectives on that? Anyone want to gaze into their crystal ball and have a view on, or is it going to be a combination of both, I guess? Piran.
So I think the answer is it's going to be a combination.
Yeah.
I don't think we can rely on technology to solve all our problems, especially in this space, because many of the technologies are untested, and even if they could be shown to work, whether they're scalable is a completely different issue as well. I think that where things have been most effective in the environmental sector in the past in terms of change is where new technologies have coincided with a will to change something. And this often brings in then regulations at the same time. So something like the Clean Air Act is a really good example of where there was already a shift in technology, but then the regulation was brought in to reduce sulfur dioxide and so on emissions. And then that was really effective in terms of actually improving air quality. And I think it's that finding where those different technology and willingness and so on coincide is where we're going to get the most effective change. And so coming back to the points that several people have made already, it's that education, sensitizing people to this, the whole phenomenon of climate change, all its impact and so on. That's a really important part of changing mindsets in all different sorts of communities and institutions. And that's where you're going to get those sorts of institutions, some willing, but also sometimes campaigning for improvements in regulations, as we've seen recently with businesses in different sectors.
Sure. Yeah, certainly not an either or sort of situation. Bessie Bullman has sent us a question asking us, what do you see as the impact on food and water insecurity in the UK on mental health? So I guess that's around whether we think mental health is likely to be affected by worries about food and water insecurity in the UK. And Piran mentioned, the kind of global sort of context for climate change, but as we know, it's increasingly apparent in our own country. So has anyone got any thoughts on whether we can see a connection between those things and mental health?
Yeah, I mean, we can see it already. Yeah. I don't think this is something we need to look into a crystal ball. We're seeing with the cost of living crisis, with food prices going up, we're seeing families, not being able to afford food. In my local area, there was a boy, maybe 10 years old, who was coming to school with an empty packed lunchbox, pretending to eat food because his parents and above the threshold to receive any support, but still, because prices have risen up, the family was not eligible. So he was pretending to eat food because he didn't want his classmates or any friends or the teachers to know that he didn't have food in his lunchbox. So we're already seeing this, and it's only going to increase. I know we've talked about in the UK, but I'm in Ghana at the moment, and in the northern region, for example, because of droughts, we're seeing an increase in drought. So we're seeing that the soil is losing its fertility. So you're seeing a massive migration of people from the north coming into the south. But when we're thinking about where we get our food from, we don't grow and eat all of our food in the UK. So it does have a knock-on effect to us and the consumers in the UK. So unfortunately, we're having a taster now. And if we don't do something about it, it's only going to get worse. It's not going to get better.
Piran and Elliot nodding in agreement. I think that's fair comment. And in a sense, just to wrap up, because we've kind of almost run out of time, so I just wanted to sort of focus on a couple of things that are sort of made an impression on me. And in a sense, that idea that climate change can impact food and water security, just for me illustrates how climate change can really ramp up and exacerbate pre-existing social determinants of health and health inequalities. And of course, Agnes, your talk really sort of cast a spotlight on the intersection of climate change and pre-existing inequalities and how those are confounded in the presence of climate change, and how do we overcome those using policy advocacy and efforts to build resilience, which I think Elliot was touching on also in his talk about how creativity and arts-based approaches can change hearts and minds and inspire people to be co-producers of a more positive future in their neighbourhoods. I think we've touched on that a few times in terms of how that's so critical that we engage people who are more likely to be affected by climate change. And Piran's talk kind of pulled out a little bit in terms of national and international focus around the idea of nature as a solution, nature-based solution, and how those solutions can have both environmental and health benefits. And that's a critical sort of switch in our thinking about climate change. It's not just about fixing the climate, but it's also about fixing sort of pathways to health and how those can be synergistic and not in conflict. So thank you all for bringing those very different and illuminating perspectives to today's webinar. As I said at the start, we've had lots of questions in the chat. I've seen my chat box open up lots of times during that final 10 minutes. We will be getting to those questions in a future blog from the centre. And for those who do want to do any kind of follow-up reading, I know the centre has recently produced 2 pieces on climate change and mental health. And I'm hoping that the link to those pieces of work are likely to be in the chat, I hope. I think Holly's possibly put those in there. And if not, they'll certainly be on the Centre for Mental Health website, Nick Trelloir's blog. Otherwise, at 1 o'clock, I'm going to wrap up and draw this webinar to a close. And again, thank Elliot, Agnes, and Piran for some very interesting and thought-provoking talks. And thank you all for your contributions on the chat.